everybody. I said we would be here, and here we are. We are at Genesis Integrated Medicine to visit Dr. John Beedle. He is helping me get this knee right. I've done all the things that I talked about in my last couple of videos already, but we're gonna go through some of the things today. After this, me and Mario are gonna head to the gym. I'm gonna show you kind of the PT stuff that he's been giving me for what I can do for my legs, how I'm training around this at this point. I just wanted to document this for you guys because, one, if you're in Vegas and you are watching my channel, this is a phenomenal place. I send most people here when they have any sort of issues, spine, hip, knee, neck, shoulder, elbow, doesn't matter. So we're gonna go in there, introduce Mario to John and all these kind peoples, and get some treatment done. Let's head in there.
What's up, everybody? Dr. John Beedle here at Genesis Integrated Medicine. We have our handsome patient over here, Mr. Jared Feather. I'm going to run through what we've been going through the past 2 months, 3 months?
Like 2 to 3 months.
2 to 3 months. Do you mind if I share your information real quick?
No, do that.
Okay, Jared came in with...
Don't tell about the STDs.
Yeah, it's only good if it burns when you work out, not when you pee. Yes. So everyone needs to keep note of that.
I learned that from John.
Yes, very good. Yeah, I got a couple one-liners for everybody. Jared came in with actually a pretty significant injury, a little rare in most offices, especially for chiropractors, because they just do cracky-backy stuff. So our office here, we're an integrated medicine clinic. We do strength conditioning, we do shockwave, we do dry needling, we do adjust, we have medical massage therapy, we do functional medicine. We're not this weird holistic clinic, so we do blood, urine, stool, hair, saliva testing.
I want to point out for my viewers, notice what he said first. What was the first thing you said you did?
Oh, dude, I've got like, I'm like that 10-second. Strength
yeah.
Oh, that's the most important. Yeah, if you don't lift weights, or if you don't understand that resistance training and low tolerance can heal the body faster than just about anything, you gotta go. Like that just, it doesn't make sense. It make sense that people don't.
100%.
It's crazy. Yeah, if any medical provider you have tells you to stop working out, you get out of their office, give us a call. I don't know if I can show you, but give you some advice.
Chemo or something.
Yes, yeah, unless it's a serious significant, but just keep following his page. We refer and we work with an orthopedic surgeon for regenerative cell therapy. Again, we are not someone selling strip club tickets on the strip and also selling stem cells. We actually understand the data of it. I know people say there's not a lot of data on it, but we use a lot of, every patient is a case study here and we do everything ethically. So
they know all my shit, so you just rap about how you feel about it, because you know, on my channel I talk about all of it all the time. Yeah,
I think with stem cells, that's a great topic. I think with stem cells, what's happening right now is it's a cash cow. Just kind of like what's going on with peptides. Everyone's like, hey, here's a referral code, use this peptide. You're gonna be a 5'10" Caucasian man and you're gonna do a little bit of CJC and you're gonna look like Ronnie Coleman. That's not how it works, right? You gotta utilize and leverage the tool at the right time. So when it comes down to stem cells, it comes down to a process. A lot of clinics will just say, hey, you are a high ticket client. I'm going to give you a high ticket product and they will give you unleaded quality treatment, right? So what we'd like to do at our clinic, we offer the product at just about provider's cost. You just cover the time for the orthopedic surgeon. She's amazing, Dr. Bacheron. Google her. Do not annoy her though, because then she will kill me and I will kill you. So
she might kill you either way.
Yeah, regardless. Yeah,
she's pretty great.
Wouldn't be that bad though.
no,
she's the best.
She puts you out quick.
She's literally the best. She's the best. But when it comes down to regen, a lot of times what happens is people go, whoa, we could go to Panama, we could go to Mexico City or Tijuana. The only thing getting Tijuana is Hong Kong. If you know what that is, then you know. If you don't know, don't Google it. When you go to these clinics in Mexico or another country, you're basically paying for your flight, you're paying to be put on a bus with a bunch of random people, and you get one injection and you get zero education. Clinics in America, they will give you 2 cc's, if you guys know what that is. That is about the size of 2 pinkies, okay? That'll be anywhere from $8,000 to $15,000. And then they'll say, ooh, use this hyperbaric chamber, all these sexy biohacking marketing things to help you. I'm not saying that they aren't beneficial. What I'm saying is that is more marketing and sales. What we need is more of a system. So our system here that we've done with Jared, back to his injury. So Jared had a distal subcortical fracture in his femur. Okay, it was about 1.6 centimeters. Okay, lots of edema, no tolerance for flexion when loading. When we started with him, we started with a series of 2 injections. After that injection, we did 4 weeks of strength and conditioning. After 4 weeks of strength conditioning, we went back and did another round of injections. When anyone does regenerative cell therapy, if you guys are looking into it, do not do a one and done. If you just get the injection, do not expect to feel better. It might decrease inflammation, but you are not working on anything like load tolerance, range of motion with tolerance, or with resistance, anything. You're not recovering your tissue. You're just decreasing inflammation. What we need to do is we need to prepare you to train, right? Activation, strength, conditioning, and then rehab. So what we did with Jared, we did our first round of injections, 4 weeks strength and conditioning, right? Second round of injections.
Yeah, 1 week of being off since it was
1 week of being off. Yes,
injections.
I like people to take 1 week off because then we do strength and conditioning with an injured athlete for 4 weeks straight. We did 3 days a week.
Yep.
3 days a week.
Okay.
With our first 4 weeks, I document everything. I'm a big VAS guy, so I always do a number scale. Jared came in, he started off at a 7 out of 10 for a majority of his movements. After 4 weeks, we got him down to a 3 to 4 out of 10 with movements, okay? Consistently. He went off to, we did 1 injection before you went to
Miami.
Yeah. Yep. And then he came back from Miami. What we did, I left Jared, let him take BFR cuffs, right?
Yeah.
We did all of our,
Yep. Trained over there.
we gave him all of
2 times
his
a week.
activation, all of his activation stuff, just so he could stay consistent with things. The thing is, when you guys see a provider, you need to have education on how to manage your pain. That way you don't have to consistently rely on your provider. Now this, nothing against other patients, Jared is a little more academically inclined with strength and conditioning compared to most patients, so he also knows tolerance and what his body needs. So when he came back, got back into it, your pain the other day after coming back from Ohio, that's after a long
flight.
Yeah, from the flight, but after a long day of standing, your pain only got to a 7, right?
Yeah.
And that was after
Yeah.
standing for how many hours
Yeah,
every day?
it's every day.
Every day. I
Basically
mean, it
the whole
was-
fucking day.
It was at the Arnold, right? He was standing all day. So that just goes to show his conditioning phase up into work. He's way more tolerable. Now the injury's still there. However, came back, got another image on Jared, and what did we see on the image?
Yeah, they said they didn't see the fracture at least.
They
right
said
now.
there's edema.
Edema.
So there's still edema.
It's softening of the tissue.
Softening
obviously.
of the tissue,
Yeah.
still bone edema, but there's no subcortical fracture, the distal femur, right? And we had our
So it is
orthopedic
healing.
surgeon review it, so we are healing. So what we're gonna do with Jared, we're gonna be continuing what we do, Shockwave, we're gonna do soft tissue therapy. When I say soft tissue therapy, this is not a rub and tug, right? Again, this is gonna be Shockwave. This is gonna be Shockwave, so what we wanna do is we want to do passive range of motion. So Pauline will come in here, she's gonna be stuck on the camera. She's a mystery character in this office. We're gonna do Shockwave, we're gonna take him through a series of range of motions to decrease pain in the knee area, in the distal femur, by working on the surrounding tissues. So,
And the reason that I refer everybody to John and the reason, or Dr. Beedle, you motherfuckers.
or you
him
can call
Dr.
me
Beedle.
Papa John, you know,
Papa
whatever
John.
you, Papa John, Dr. Listen, I'm a chiropractor, it's serious, it's not that deep.
But like
It's
legit,
all right.
me and John are friends, and he knows, like he said, we both have a high educational background. He genuinely wants people to get better, and he probably doesn't want me to say this, but I'm going to. I am one of those people who's super skeptical of stem cells, and he literally covered most of it because he legitimately, with all of his patients, just wants them to get better and get back into movement. He knows it's been a very frustrating injury for me because being told by somebody it's potentially career-ending doesn't sound great. But me and him are both very, very headstrong on like not letting that be a reality for me, and him literally just covering most of that for me, just to give them a good case study and see if they're working or not, is like, it means more than he knows. So it's shit like that and providers like this that give me faith in this side of the kind of like health and wellness space. So legit, one of the best in the business. I'm very fortunate to know him and be able to send people that I know to him. So anybody watching that lives here or close, they're amazing.
I appreciate it.
Dude,
I
watch
appreciate
both.
them.
Yeah, man, no, I mean it.
I appreciate that. Yeah, guys, like, at the end of the day, you have an opportunity to make money every day. In our office, we are very big on putting the patient first, and we don't just say that, we actually mean that. This year,
Bacheron too, man. Like
same with Dr. Bat, our whole team, everyone
that's cool.
in our medical team, our office is kind of like a miniature hospital just without the shitty lighting, right? Like, we have an amazing nurse practitioner that does all of our non-steroidal trigger point injections. We still use steroidal trigger. We're not anti anything. We're just anti shitty business plans and business models. That's the problem, I think, with medicine right now. Is the pharmaceutical industry bad? No, everyone hates the business model of the pharmaceutical industry. There's no education in it. But then the patient also doesn't want to do the education, and then they'll listen to some holistic functional medicine provider, or they'll listen to some fucking podcast, and then they're like, oh my God, the pharmaceutical industry is terrible. I'm gonna go spend thousands of dollars on supplements, and now I'm taking 50 supplements, and I don't know what the fuck they're doing.
Yep.
You see what I mean? It's the business model. A lot of times with just these series of, like, with Dr. Bacheron, she is one of the top providers in the regenerative cell therapy region, and she also teaches and educates providers on it. The problem is that providers take that education and they create their own business model that might not match our ethics. And nothing against them, that's just their business model. I'm not against them getting their bread, but whatever. When it comes to functional medicine, right, a lot of people just do podcasts, and they'll just say whatever they heard in a podcast. We're certified here. I did the Institute of Functional Medicine through the Cleveland Clinic, 300-hour program. I did Functional Medicine University, another 300-hour program. I got my master's in blood chemistry, another 300-hour program.
I'm gonna put that out there too.
Right,
like with functional medicine, you gotta learn how to read lab work really well.
You have
and
to.
John is one of the best about reading lab work, and he knows how it works in conjunction with hormones. Like, straight up, I'm an enhanced athlete. He works with a ton of enhanced athletes.
Yeah.
And he knows very well what that lab work is supposed to look like and what it's not supposed to look like. So some people freak out very heavily when they become enhanced and get their lab work done. John knows what it should look like and why you should or shouldn't freak out. So that's a big help too.
It's all part of the game plan, and we just put a lot of money in our education here because we want to be able to, the more money we can spend on education, the more money we can save patients, right? 100%. And we're not here to be a fucking charity clinic and sound like we're these super godly people, but when it comes to our patients are our family. And just like with Jared's case, right? Like, it's just, as an athlete, the most alarming thing is the effect on your mentality, right? Of having an injury and then seeing what it was doing to him and knowing that he was my friend. We just had to take care of him just like how we would anyone. So, and we do it 1,000 times over. So let's get started. Let's crush this shit. All right, guys. Okay, so what we're gonna do, we're gonna work on the interior. So Paulina's gonna come over here. She's gonna bring her lovely little model hands over here. And what we're gonna do, she's gonna place her hands right here. We're gonna drive the foot down. Joe's just gonna relax his foot the best he can. We're gonna drive all the way up. We're gonna plantar flex and dorsiflex, okay?
Oh, my feet. Paulina, you better put gloves
Yeah, this
on.
costs extra for everyone. So that costs extra for everybody. So what we're gonna do, guys, so this is radio pulse wave, this Shockwave, sounds like a taser. I think that's why they named it that. I don't know, kind of cool, kind of gay. What we're gonna do is we're gonna stimulate this region of the muscles. We're gonna be palpating for adhesions. Adhesions are a legitimate thing. They're just not gonna fucking pin you down like however people, it's just however people wanna market and sell things to you. So what we're gonna do, we're just gonna move this region within the area, and then we're gonna stimulate it, and then he's gonna have more range of motion, he's gonna feel better. That's to summarize it. No sexy marketing, okay? Jared, let me know how this pressure is.
Hello.
Good, can you handle more?
Feels decent.
Decent? You want?
Yeah, fine.
That's good.
Cool. All right, ready? Let's run it. Okay. So we're gonna go here. So one thing about Jared's case we've learned, working on posterior chain, distal posterior chain has helped him out a lot, right? Distal posterior and anterior decreased a lot in its pain and its intensity, right? And frequency. This guy is so active, he's on his feet all the fucking time, right? So not only does he's able to have a crazy amount of load through strength training and bodybuilding, but just every day going to conventions, staying on his feet, and just being a genuine guy. He'll walk up and shake anyone's hand. That's one thing I love about this guy. So what we want to do, like I said, we're not massage therapists. It's not a rub and tug. We want to palpate, find the most height.
That's after, yeah, that's off cam.
Okay,
that's
perfect.
off cam, right? So what we want to do, we want to palpate. We want to find the tightest spot or the tissue with the less depth. And we want to break that tissue down. And he's feeling that spot right there. That's a good spicy spot, as we say in here. So one thing too, when we're getting treatment, right?
I think there's a big misconception. This is just my personal belief. I'm not discrediting anyone. I don't understand the point of more pain is more gain. I do not believe in that. I think if it fucking hurts, that causes you to guard more, and the purpose is to not have guarding so that we aren't walking like we have a stick up our ass. So we want to have, but we also need to have at least some form of pressure to where we can get some, at least a reaction, right? But I don't believe that we need to beat the shit out of people unless we get paid for it, and maybe it's behind bedroom doors, right?
And I talked about this on the channel, but guarding is just the body's natural want to flinch
We're gonna go
and protect
here.
an area that is injured. So
in.
right now with my knee, anything that touches anywhere around my knee, I immediately get that like
Automatic.
guarding automatic response.
And that's the hardest to treat him, right? Because automatically, mentally, how am I supposed to make a patient feel comfortable, and how are we supposed to get a good outcome of care if he is already feeling like he has to protect himself, right? We're not gonna be able to get to where we fully need to go. So now we're gonna work on his proneal group. So what Pauline is gonna do, this is the one thing about Jared, you kind of gotta hold him down a little bit. He likes it though.
Very
And we're
ticklish.
gonna wave it in, and then we're gonna do inversion and eversion, and work on these peroneals right here.
Whoa, are you good with that? Yeah, that's a good spot, right? So peroneals are going to be a big muscle group that we want to treat with him, especially it's eversion, inversion, because this is going to be supporting us when we're hitting on and off steps, curves, right? It's going to help provide stability within this ankle and all the way up to the knee. The more sturdy he feels, the more proprioception goes up. The more proprioception goes up, the more comfortable you feel with movements. The more comfortable you feel with movements, easier it is to move. The easier it is to move, the more we can heal.
So Jared has, as they say for MRIs, all MRI readings, kind of the verbiage has to be universal, right? So sometimes when you see things like disease and things like that, you're not gonna fucking die, not for all the times, but it's gotta be universal, right? So when we see things like that, right, he's got moderate to severe chondromalacia. Chondromalacia is when on the posterior aspect of the patella, cartilage deteriorates and then it kind of turns into like sandpaper, and then it causes this grinding motion and it can cause sharp pain. Chondromalacia is super common in bodybuilding and basically like kind of any athlete in general. So what we want to do is we want to stimulate angiogenesis within this region around here. It's not going to create new cartilage, but we want to decrease the
Inflammation, get blood to the area. So what we're gonna do, we're just gonna be working around this knee. When I first started working with Jared, on the bars for this, he started at level 2. Now he's almost to the highest that the bars can go. How's that feel though? Not terrible, right?
Feel it.
He feels it when he first started.
Yeah,
He was
nearly as bad.
it
Pauline's like trying to see my pain face. She's like,
I see.
sick person. And I feel that.
Doing okay there?
The
Good as you can be.
medial side, that's pretty
Yep. So
spicy.
with Jared, a lot of times that we've had any reoccurrence of pain, it's been the medial aspect of his knee. We have gotten some lateral aspects though for certain movements.
Yeah.
Right.
Quite a few.
I think one thing that's really important to anyone that has an injury, again, not trying to tell your provider how to treat you, but document movements, document pain that is produced with movements that you have. Where it is, what it feels like, and on a scale of 1 to 10, if you could document that, then you could start to track and trace your pain patterns. The more you could track and trace your pain patterns, the easier it is to gonna be figure out to what's causing pain, or what can be producing more pain, or what can be decreasing pain for you. Right? Get as much data as you can. You don't need to fucking write down all these crazy degrees or anything nuts. You need to write down where it fucking hurts, why it hurts, how it hurts, and then how bad it hurts. If you do that and you can figure out the motion, then break that motion down, figure out that portion of the motion that causes the most amount of pain, and then heal yourself. So now we're gonna be working on the adductors. Jared likes it when we work over here. Like I said, we want to work on the surrounding tissue. He loves this medial portion of his leg worked in. He loves it. So see, this is how we
Like it
know.
also like pulls my hair. I'm like,
Oh yeah.
So we'll just lube him up a little more.
Lube
but
me up,
again,
John. Jesus.
that's when we know.
Lube it up before you put
That's
it on.
when we know when we're close to that patient's threshold region.
Need more lube? Yeah, I use that same retort in the bedroom. So you know when you're close to the threshold.
We just go in dry.
Just got to get a little more
We
lube.
just get in there. All right. So what we're gonna do now, hit this adductor region. Just see we're getting nice stimulus in here, getting a little red, getting that blood flow in there, getting him ready for this trip he's going on. He's gonna do great. And then I talked to our orthopedic surgeon, Dr. Bashron, who's an angel, and we, when Jared comes back, we kind of briefly talked about it, but we're going to be paying for and doing a stem cell IV for him. Another thing, when I first started working with Jared, we went over some blood work. He's referred a couple athletes over here and treating them, and went over some blood work with them and saw some things from his previous health history that we wanted to work on, right? Genetic factors. And after talking to Dr. Bashron, you know, we kind of realized, hey, I think that getting something systemic in him would be great. So when he comes back from the Philippines, we are going to have a regen IV set up for him. And then we're going to get some systemic stem cells in him. Help him out in some other areas. Definitely in this recovery aspect. Recovery is going to be the biggest thing. A lot of times people think they need to add more resistance bands or follow more people on Instagram, but really sometimes it comes down to how well can we sleep, how well do we recover, right? That's going to be the most important thing. You don't need to fucking inject NAD or whatever the fuck people are doing now. You're fine. I'm not saying NAD's bad, just...
No, you're right.
You don't need to fucking spend all this money on all this other stupid shit, dude. Just start with fucking sleeping.
Chick-fil-A. John is one of the only chiros that I've met that fully understands this entire scope of practice and outside of his own. So full trust in him. You guys have heard me say chiropractic work is fake science. I'm sure. I'm sure I said it on my channel.
A lot of it is. The business model's fake.
Yeah, 100%.
The business model's very, you know, like I chose to become a chiropractor because every state has a different scope, right? But I also chose it because, like, after doing rotations, I was like, wow, there's so much more that we can actually be doing for people to help others instead of just doing cracky-backy stuff. Weird fact, a lot of the books that we use in that, I guess we'll just say medical school at MD, whatever the fuck you want to call it. Yeah. A lot of books have been written by chiropractors. There's a lot of smart, book of physiology, chiropractor.
Yeah.
Crazy. But
well, that makes sense. You learn the human systems like more than anything.
You know, it's just, I know, we go to school more, but I think the thing that the issue is that they spend all this money on their education and we have more educational hours. The medical directors, the issue is they only do one thing, one trick pony.
Yep.
I'm not saying that you need to be master at all, and definitely don't be a fucking idiot and doing something you don't know what the fuck you're doing to get more money.
Yeah.
Stay educated, right? I got all these credentials before I even left school so that when I get out of school, I could start applying myself to the community and learning more instead of putting myself in a fucking casket of just adjusting. Do adjustments help? I guess. I mean, so do shots of tequila.
Yeah, it's all case by case.
So do shots of tequila.
Right.
Right? You know,
Case
I
by
think it
case.
just depends on the patient, but you know, at the end of the day, you have to listen to the individual and give the individual what they need. It's not going to be able to be the same thing for every fucking person. Sorry, I cuss. I'm a normal guy.
They never heard that from me.
Yeah, yeah. So I think, you know, at the end of the day, like with a case like Jared, a lot of times, and I'm not saying all providers, but a lot of times people have an athlete like this come in. Not that we don't have open discussion, but Jared's coming in for me to help him, you know, and I think a lot of times what happens is when providers get high-level athletes, high-level people, they forget that they're still their patient, and then there's some things that the patient knows that the doctor might know, and there's some things that the doctor knows that the patient doesn't know. We are here to lead, right? But we're also here to compromise and work together. And I think what happens a lot of times is there's that disconnect between patient and provider, especially athlete and provider. And it's a team. It's a team thing, right? There's things that he's like, hey man, you know, this is not working for this exercise hurts. Okay, cool. We got to cut it, or we work on getting into that exercise at full depth that we need to get into, right? So guys, we really appreciate having you in here. Jared is an absolute blessing. Hopefully we see you guys more. I'm gonna go get to my next patient.
Yeah, of course.
Okay, I appreciate you, dude. I love you. Let's get you in and we'll get some content on that stem cell IV.
100%.
Okay, sound good?
Great.
All right, love you guys.
Thank you.
Bye. Okay.